Introduction: Understanding the kidneys. Today we're going to look at the earliest sign of kidney disease, and it may actually surprise you. The kidneys work as filters, turning blood into urine, but they're far more complex than simple passive filters. They actively manage and recycle fluids in the body. For example, imagine you drink around 8 glasses of water a day. For those in Europe, like Dennis from Germany, that's roughly 2 liters. If you consume 2 liters of fluid, you'll pass about that much urine over the course of your day. But here's the interesting part. Your kidneys process about 180 liters of fluid every single day. That equals roughly 760 cups. So only a tiny portion becomes urine, most of it is recycled. The kidneys return water, protein, nutrients, hormones, and minerals back to the body, recovering roughly 99% of the water you drink. They also contain sensors that regulate fluid balance, activate vitamin D, manage blood pressure, maintain hydration, and remove toxins and medications. When you understand what each nephron, the tiny filtering unit, does, you'll likely reconsider eating junk foods and other things that strain the kidneys. It truly is an impressive organ. What causes kidney disease? The average person has between 1 million and 1.5 million nephrons in each kidney. When kidney disease begins, the number of functioning nephrons gradually drops. With age, nephron count naturally declines as well, reducing your ability to filter and recycle effectively. The most common cause of kidney disease, and the main reason people progress to end-stage renal failure, is diabetes. The condition is known as diabetic nephropathy. Nephro equals kidney. Apathy equals disease. Chronic high blood sugar interacts with proteins and enzymes in the body, triggering a process called glycation. This chemical reaction alters proteins, damages them, and leads to the formation of advanced glycation end products, AGEs. When AGEs build up, they clog and disable nephrons. As these filters become impaired, protein that should be recycled back into the bloodstream begins leaking into the urine. This is why protein in the urine is one of the main diagnostic signs of kidney damage. With protein lost in the urine, blood protein levels drop, which causes edema, fluid buildup. This swelling can appear in the face, hands, legs, and throughout the body. One important thing to remember is that kidney disease progresses silently. It can take up to 10 years before symptoms become noticeable. The first sign of kidney disease. Now, let's talk about the earliest symptom people typically experience: nocturia. Nocturia means waking up during the night to urinate, often multiple times, and it becomes increasingly difficult to sleep uninterrupted. Holding your urine throughout the night is often an early sign that something may be affecting your kidneys. This connection is logical, as many people with diabetes experience the same symptom. Diabetes typically develops slowly, often taking around 10 years before noticeable issues appear, so kidney problems often develop alongside it. Other symptoms of kidney issues include changes that appear in 4 major areas of the body affected by diabetes: the kidneys, the eyes, the nervous system, and the arteries. When the kidneys are involved, you may find protein in the urine and a reduced filtration rate. That means the kidneys are no longer filtering properly, leading to a buildup of toxins and a loss of essential nutrients like amino acids. This can eventually result in significant edema. Because kidney damage progresses slowly over many years, it can be difficult to clearly connect cause and effect. How to reduce nighttime urination, nocturia. In my experience, the most effective way to reduce nocturia is to address the underlying blood sugar problem. Let's go through that briefly. In conventional medicine, diabetes is described as a condition in which blood sugar levels are poorly controlled. The key word here is controlled, and another term often used is managed. Healthcare providers manage symptoms and complications of diabetes, but rarely focus on correcting the root cause. Why not focus on controlling what the patient eats, especially in terms of sugar? The amount of sugar and refined carbohydrates the average person consumes, through bread, pasta, cereal, crackers, and other hidden sources, is extremely high. This makes it clear why diabetes is so widespread. People are simply eating too many carbohydrates. Despite acknowledging the link between carbs and blood sugar, Major organizations like the American Diabetes Association still do not specify how many carbohydrates a person should limit. They agree carbs should be reduced, which is good, but provide no clear guidance on how much. Instead, the emphasis is on managing complications. Fluid retention is treated with diuretics. High cholesterol is treated with statins. High blood pressure is treated with antihypertensive medication. High blood sugar is treated with metformin, insulin, and other diabetes drugs. But this leads to an important question. Nocturia means waking up during the night to urinate, often multiple times, and it becomes increasingly difficult to sleep uninterrupted. When you work on controlling your blood sugar, the sugar doesn't simply vanish. It doesn't evaporate or disappear on its own. It's simply transferred from one area of the body to another. It moves out of your bloodstream and into your cells, into your liver, around your organs, and eventually gets converted into fat. And then there are the side effects of the medications used to manage diabetic complications, another issue that often gets overlooked. So whether you're already dealing with kidney concerns, trying to avoid them, or waking up at night to urinate frequently, there are several steps you can take to help improve the situation. The first and most straightforward action is to lower the amount of sugar circulating in your blood. This usually means following a ketogenic-style eating plan. The second step is intermittent fasting. Eating less reduces insulin levels, lowers insulin resistance, and decreases the progression of diabetes. These two approaches complement each other. The intermittent fasting routine I suggest is the one I currently follow. About 1.5 meals per day. Here's what that looks like. You have your main meal a little after noon, or even right at noon. This meal includes your protein and healthy fats. Later in the day, personally I prefer around 3 o'clock, though some people may choose 6, you have what you can consider your second meal or half meal. This isn't a heavy meal and it's not focused on protein or fat. Instead, it's made up of your vegetable carbohydrates. For me, around 3 or 3:30 at the latest, I have a large salad containing roughly 7 to 10 cups of greens. I usually reach closer to 10 cups, but 7 works too. It's a substantial salad, yet easy to eat since it's mostly leafy vegetables. I'm not eating anything else after this, because my protein and fat were already consumed at noon. This timing also makes the salad easier to enjoy because I'm not rushing. I add things like olive oil and sometimes apple cider vinegar or balsamic vinaigrette. Occasionally, I'll add seeds or a few nuts, but the base is always the greens. I rotate different types, arugula, cabbage, and others. If I use cabbage or another dense vegetable, I don't eat 7 to 10 cups. Those vegetables are heavier, so the quantity can be smaller. When I mention 7 to 10 cups, I'm referring specifically to loose salad greens. This routine works well for me because it creates a long fasting window, which supports better blood sugar control. Despite acknowledging the link between carbs and blood sugar, major organizations like the American Diabetes Association still do not specify how many carbohydrates a person should limit. They agree carbs should be reduced, which is good, but provide no clear guidance on how much. Instead, the emphasis is on managing complications. Fluid retention is treated with diuretics. High cholesterol is treated with statins. High blood pressure is treated with antihypertensive medication. High blood sugar is treated with metformin, insulin, and other diabetes drugs. But this leads to an important question. Nocturia means waking up during the night to urinate, often multiple times, and it becomes increasingly difficult to sleep uninterrupted. Period. Okay, am I hungry for that salad? Not really, because I just ate a few hours ago. But roughly, it gives me about 21 hours of fasting. There are a few important things about this salad that relate directly to kidney health and diabetes complications. People often talk about vitamins and minerals in salads, but there's something even more crucial: phytonutrients. Phytonutrients have many benefits, but the key one here is nephroprotection. They protect the kidneys from oxidative stress and the complications caused by high blood sugar. Imagine 2 people with diabetes. One eats a diet low in phytonutrients, and the other eats a diet rich in phytonutrients. Both are diabetic, but the person consuming phytonutrients will experience far fewer complications. These phytonutrients act as antioxidants, helping neutralize the harmful effects of high glucose in the bloodstream. That's why consuming a large salad daily is highly beneficial. Along with phytonutrients, salads also provide magnesium, vitamin C, and potassium, all important for kidney protection. Unless you have end-stage kidney disease, in which case you should follow your doctor's guidance. Next, there's a supplement backed by research called benfotiamine, a fat-soluble form of vitamin B1. It helps reduce common complications of diabetes by lowering glycation, reducing oxidative stress, and protecting cells. This makes it particularly effective for peripheral neuropathy, nerve damage in the feet, diabetic retinopathy, eye issues, and diabetic nephropathy, kidney damage. The typical dosage is 300 milligrams, 4 times a day. Other supplements can also help. Alpha-lipoic acid is effective in reducing complications, and turmeric, containing curcumin, is potent for decreasing diabetes-related symptoms and complications. The underlying goal is to reduce carbohydrates and address the root problem, which is why keto and intermittent fasting are highly recommended. At the same time, these supplements and dietary choices help mitigate the side effects of high blood sugar. If lowering carbohydrates is challenging, adding these remedies can still reduce complications and, in some cases, decrease the need for medication, always under your doctor's supervision. For those who experience frequent nighttime urination, these strategies can be particularly useful. Even if you don't think you're diabetic, it's wise to check insulin resistance with a HOMA-IR test, as it often appears before diabetes develops. There's a clear connection between carbohydrate intake and nocturia. To learn more about creating the right plan, including what to eat and how to do intermittent fasting, check out my simple playlist here. Despite acknowledging the link between carbs and blood sugar, major organizations like the American Diabetes Association still do not specify how many carbohydrates a person should limit. They agree carbs should be reduced, which is good, but provide no clear guidance on how much. Instead, the emphasis is on managing complications. Fluid retention is treated with diuretics. High cholesterol is treated with statins. High blood pressure is treated with antihypertensive medication. High blood sugar is treated with metformin, insulin, and other diabetes drugs. But this leads to an important question. Nocturia means waking up during the night to urinate, often multiple times, and it becomes increasingly difficult to sleep uninterrupted.